Laser prostatectomy is basically a way of using a laser instead of an electric loop to create a channel through the prostate to help you pass water more easily. And that might be suitable for a patient who's got really unacceptable lower urinary tract symptoms like straining to pass water or getting up too much at night. Or it might be for someone who's actually already gone into urinary retention and is enduring the discomfort of having a indwelling urethral catheter. So TURP or TURP is the old-fashioned way of creating a channel through the prostate to help you pee. It's a time-honored operation. It's a good operation. It's a gold standard to which other operations are measured. The advantage of the HoLEP, and the reason why it's being argued by many as the new gold standard, is because it's able to cope with much bigger prostates. It's more definitive. So TURP unfortunately has a reoperation rate, 1 to 2% per year cumulative. So 10 years after your TURP operation, you've got a 1 in 5 chance of needing another operation, whereas doesn't happen with HoLEP because you remove so much tissue. The other big advantage is it's great for cautery. The holmium laser that we use is absorbed very strongly by hemoglobin, and that means that you get very clean cuts and very little bleeding. And the follow-on advantage for that from the patient's point of view is less time spent in hospital. So you can expect to stay in hospital 2 to 3 nights after a TURP operation, typically 1, possibly 2 nights after a HoLEP operation. And of course, if you're worried about blood transfusion, the risks are way lower in terms of blood transfusion after a laser prostatectomy. Just like the TURP, all the cuts are done on the inside. So there's no cuts on the outside of the body. Everything's done through the tip of the penis. The telescope is passed down through the water passage, the urethra, until you reach the prostate. I quite often say to patients, imagine at this point that the prostate is an orange. And if you had a healthy prostate, you'd have a nice big hole at the North Pole and a channel down to the South Pole, and you'd pee through the middle of it, because we pee through the middles of our prostate, a bit like an American donut, if you like. And so what you do, returning to the orange analogy with the laser prostate, is you pass the telescope down the penis and arrive at the South Pole of the prostate, and you use the laser a bit like you might use your thumb to separate the orange flesh from the orange skin. You leave the skin of the orange behind. In other words, you don't take the entire prostate, but you get rid of all the fleshy tissue in the middle that's causing the obstruction, and that floats off into the bladder, and we use a special machine to suck it out. And then that leaves you with a nice big hole at the top North Pole of the orange prostate, a nice big cavity in the middle, and a nice hole at the South Pole. And that's how you're able to pee afterwards. In general terms, after any operation, there's always a risk of clots to legs, lungs, heart, and brain, which is the scary bit, right? But the risk, it goes up if you are on any blood thinning medication. And if you are, you'd need to stop it for a short period. And we've recently published on a protocol on how to stop these with the best safety, especially for NOAC medications such as apixaban and rivaroxaban, which patients are often on. In terms of the procedure itself, the main concern is urinary incontinence. The risk of urinary incontinence is only 1 to 2%. And that compares with TURP, where the risk is 0.5 to 1%. So the risk of incontinence is slightly higher with the laser prostatectomy. You can expect to be incontinent on and off just occasionally for the first few months, and that is normal because a lot of patients have been have very large prostates, and their pelvic floor muscles haven't had to be used for a very long time. So there's a sort of process of retraining that happens at that point. Some patients, about 1 in 7 patients, may notice an effect on their erections. And it's very common, very common, just like TURP, to have a phenomenon called retrograde ejaculation, which is where the gentleman will have a dry orgasm, basically, and all the ejaculate goes back up into the bladder, which is harmless and obviously gets peed out later. So those are the main complications. There's a really good leaflet on our website, the Anglian Urology Associates website. So that's worth having a look at. It's the bowel procedure specific information sheet, which goes into even more detail and has a nice video. So after the operation, which may be done under a general anesthetic, it may be done under a spinal, depending on fitness and so on, the patient will wake up with a catheter in. A catheter is what's called a three-way catheter. There may be a little bit of bloody urine coming out. There may be some irrigation fluid going in, and that stays typically for about 12 hours or so. The following morning, the catheter is removed, and the nurses on the ward will check that you're able to pass water okay, and we'll probably do a little scan of your bladder to make sure that you're emptying your bladder properly before you go home. After that, you've got to be really careful, no heavy lifting, and not too many domestic chores. You've got to just take it nice and easy. Walking is fine, but nothing more than that really for the first 3 or 4 weeks. And that means that everything can seal up nicely. You don't get any bleeding, and a bit of rest and recuperation really, while still remaining active. In terms of follow-up, the catheters come out, you've gone home, we will send the tissue that we get from the laser prostatectomy off to the lab, and that gets looked at under the microscope, and then your urologist will see you normally about 3 months down the line with the results of that, and to check how you're doing. Basically, the recovery is good, you're going to feel okay, and people get into but people quite often need to be near a toilet those first few days because their bladder hasn't been able to function quite so well, and people are quite often wowed by the force and power of their urinary flow because they haven't been unobstructed for such a long time. I like doing this operation because the feedback is good and patients come back happy.